We are back now at 8:43 on your Tuesday morning. And late this morning, we learned Demaryius Thomas was diagnosed with CTE after he had died. Our 9Health expert, Dr. Payal Kohli, here with us now to talk a little bit more about this. Dr. Kohli, as you and I were just discussing, I think these three letters are going to be something we unfortunately are going to hear a lot more. So I think it's really important for us right now to get a firm understanding of what even is CTE.
CTE, Jordan, chronic traumatic encephalopathy, is actually a condition we've known about since the 1920s. And we really first found it in boxers, and it was called punch-drunk syndrome because they had these repetitive microtraumas to the brain, concussive and preconcussive syndromes that caused injury. And essentially what happens when you have the trauma to the brain is that it causes changes in the brain that make a protein called tau accumulate. So the brain gets injured. When it heals itself, it has deposition of this protein called tau, and that's what leads to the symptoms and signs of CTE.
And what we were talking about is that this is actually pretty sneaky for doctors. You were saying it's kind of hard to diagnose.
It is nearly impossible to diagnose because there's no blood test, there's no brain scan that will tell us whether or not you have CTE, what the deposition pattern is. The only way to really diagnose it is post-mortem. And so we often get the diagnosis incorrect. Either we miss the diagnosis when the person is alive, or we give them a diagnosis because they have a history of brain trauma. And then when they die, sometimes we actually end up being wrong.
Wow. And you know, one thing we're learning a little bit more is that this actually has layers to it, because they're saying that Demaryius Thomas was diagnosed with stage 2 CTE. So what exactly are the different stages? What are the different severities and the symptoms that go along with them?
That's another thing that's very challenging. So the staging system depends on how much of that tau protein is accumulated and what the distribution of that accumulation is. So that's of course hard to know when a person is alive, but you can tell based on the symptoms they're having. So in the early stage, stage 1, which is very mild CTE, you really start to have headaches and maybe you're not thinking quite as clearly. Stage 2 is where we start to see some of those mood changes, mood lability, irritability, anxiety occurring, early memory changes as well. Stage 3 is those higher level functions, planning, memory, execution, those start to fall apart. And stage 4, it starts to look like Alzheimer's, dementia, and you can also have movement problems like you do with Parkinson's.
Well, and I think it's really interesting that we were talking about the difficulty to diagnose this, because we know that Demaryius Thomas was also diagnosed with seizure disorders, but his doctors are saying they don't think that's related to the CTE. What exactly do we know about kind of the interconnections there?
Very, very interesting there also. The Mayo Clinic has some studies that show that there may actually be an association between seizure disorder and CTE. Because if you think about what causes both of those conditions, we know that seizure disorder can occur after a traumatic brain injury. And we know that in the right genetically susceptible people, CTE can occur after traumatic brain injury. So we think that there is some interconnectedness or some association. Now, with Demaryius Thomas, it's hard to know if his seizure was a result of his motor vehicle accident and his traumatic brain injury, or a result of, his playing football for many, many years. But again, it's possible that a predisposition to CTE genetically could have also predisposed him to have the seizure disorder.
Well, so I'm interested that you say that now, because, and I hope this is not a faux pas to ask you, I know this is when we're talking about this specific case, but I obviously you were not part of this diagnosis, but his cause of death right now remains undetermined. Is it possible that maybe CTE could have contributed?
He had stage 2 CTE, so we know that it wasn't so far advanced that it was contributing to advanced neurological symptoms, but certainly that seizure disorder, that epilepsy that he had, could very much have been very closely associated with CTE. So I think certainly the CTE could have played a role in his cause of death, which we think may be due to his epileptic seizure.
All right, Dr. Kohli, I have a feeling we're going to be picking your brain a lot about these three letters as we learn more about this specific case and just in general as you and I were talking about this. Unfortunately, as maybe we do learn a little bit more how to diagnose this, I think we're going to see it pop up, unfortunately, a little bit more. All right, Dr. Kohli, thank you so much for being with us.